son was in Las Vegas with a lot of his friends and he came home. He didn't come home last night, and I don't want prayers. I don't want thoughts. I want gun control, and I hope to God nobody else sends me any more prayers. I want gun control. No more guns.
Well, that's powerful, and it's true, and it's a mother. Welcome back to Harbor. That was a call for gun control from the mother of a victim of Wednesday's mass shooting out at Thousand Oaks, California. According to the Gun Violence Archive, the United States has had 307 mass shootings classified as more than 4 people shot since the start of 2018, just this year. And we're on the 313th day of 2018. There's almost one a day. In fact, earlier this year, the NRA tweeted an article criticized the American College of Physicians for publishing guidelines on gun violence, which they describe as a public health crisis. Well, the NRA wrote, someone should tell self-important anti-gun doctors to stay in their lane. Well, there's a swift response to that from doctors to that. Tweeted, in fact, one doctor, Dr. Joseph Sackler, the director of emergency surgery at Johns Hopkins University and a survivor of gun violence, tweeted, I cannot believe the audacity of the NRA to make such a divisive statement. We take care of these patients every day. Where are they when I'm having to tell all those families their loved one has died? Dr. Sackler, who is also a board member of the Brady Campaign to Prevent Gun Violence, joins me now. So you have to, luckily, I've only been watching that on television over the years. You have to walk into that waiting room at the hospital.
Yeah, well, Chris, let me first say thank you very much for having me. You know, that communication and that rhetoric that we've heard from the NRA is a clear demonstration to myself, the medical community, and frankly, Americans all across this country, that they are not serious about moving the needle forward on this issue. And the reality is I have to walk into that waiting room, and sometimes when I look at the faces of those mothers, sisters, fathers, brothers, I realize that what I'm about to do is rock their world. I'm about to change their life. And I often think of my own experience and what my family must have thought as that surgeon came out to talk to them. And that's something.
You were shot?
Yes, sir, yeah.
What was that circumstance?
Oh, I was a 17-year-old high school student, and it was after a high school football game, and I got hit in the throat with a .38 caliber bullet. And, you know, it was at the age of 17, I don't know how you were, but most 17-year-olds, they have no idea what they're going to do the rest of their life. And that really inspired me to go into medicine, inspired me to become a trauma surgeon, and then really figure out how do we work at that intersection of medicine, public health, and public policy.
You know, when I hear the politicians talk, some of the evangelicals, they talk about your Second Amendment rights, like there's almost a sacred thing. Your Second Amendment, as if it's somehow important to your life. Whereas you deal with the physical reality of taking bullets out of people's brains, right? Hey. You have to do that as a surgeon. You have to try to save the lives of the people whose lives are not savable.
Yeah, I mean, Chris, look, this is an important point. We are facing in this country a public health crisis. And frankly, this is not a Democratic issue. It's not a Republican issue. This is an American issue.
Why? Why do we have this? Other countries live, Japanese, the British, the French, they don't have 350 murders a year.
That's exactly
right. In one city like Baltimore. In their whole countries, they don't have it.
Chris, you're absolutely right. This is why this is a unique American problem. And until we start dealing with this like a public health crisis, we're still not going to be able to move the needle forward. And when you look at that statement by the NRA, you know, the reality is that no single individual organization can do this by themselves. This requires a multimodal approach, requiring stakeholders from all walks of life. And I'm frankly surprised because medical organizations like the American College of Surgeons have engaged the NRA. So for them to say that we should stay in our lane, I think is a little bit off basis, and they really need to analyze how best to move this.
I wonder how the Supreme Court does this. It's out of your field, but we all think about it. The Supreme Court says a right to carry a gun has nothing to do with a militia. It has nothing to do with the language of the Constitution, which was really about muskets. These are Glocks, semi-automatic weapons to carry magazines that have, how many, 30 shots in them. This guy just plugged everybody in that room. Yeah. Nobody knew of such a being. Nobody knew of such an instrument when we wrote the Constitution that could do that.
Yeah. And Chris, I agree with that point, but let me just bring it back to what I think is critical, is this is not about taking away guns. You know, folks want to make it into that discussion and polarize it. When you talk to most gun owners, we actually have a lot more in common than we have that's dissimilar. And the reality is that there is a disparity that exists between the leadership of the gun lobby and the membership.
I hope so. You know what? When they said that this guy who did the shooting and then shot himself, the 13th victim of his own hand, they said he was known to local authorities. And you know what that story is.
Yeah.
He was dangerous. They knew the problem, and nobody could do anything about it under the law. Thank you, Doctor.
Thank you so much, Chris. Thanks so much for having me.
Everything you do.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.